get things moving. I'm Justin, by the way.
Nice to meet you, Mustafa. One of the residents.
Oh, resident here. Okay.
Yes. No, not here. West Virginia.
West Virginia. University of West Virginia?
Yeah.
Really? Okay, that's good. We might be coming to see you. We have a big Ponto facility that works out of Beckley, ARH.
Oh, really?
Yeah. But we really want to be in West Virginia, like at the university.
So Beckley, West Virginia?
Yeah.
Oh, okay.
They do like 45 or so a year of Ponto.
Of Ponto.
Yeah.
Oh, interesting.
It's Dr. Douglas and Blaine.
Oh, yeah, I've heard those names.
Yeah.
They do refer to us.
Yeah.
Douglas and Blaine.
I think he lives out of like Lewisburg,
Mm.
but they obviously are out of Beckley, so.
Well,
There are old dish towels. Got to keep things safe, man.
you can always come on up. Dr. Kellermeyer is the one who does like the otology stuff. So
Yeah.
if you want to reach out.
How long have you been
This is
resident
my
there?
Fourth year now.
Fourth year now? Okay. Where are you thinking fellowship?
I don't know. There's 19 neurotology programs across the country this year, so I'll be applying and see.
Yeah. Where do you want to end up? I guess should be the question.
I think the top one is like Michiganeer now, or
Michiganeer, yeah. I do know those guys very well.
yeah.
What's that? Yeah, MIPS.
Miami is a good.
Miami's a good one, yep.
Minimally invasive poncho.
Oh, okay, very good.
Are you doing it too?
Yeah.
Come on in.
Okay.
We're gonna do some video. No, either of you. I don't care. Whoever, just step in. I'm gonna be the guide. Do I need to turn this on? Are we on? We're good. All right.
Okay.
So what we're gonna do is we're gonna start off with MIPS. Okay. We do have a mono, and I'll probably, if you want to try that, we'll do that afterwards. But this is kind of like, we'll call it the entry into Ponto.
Okay.
And what we're doing is, if you look here, we're going to do everything through this cannula here. And then we're basically going to do all of our drilling. So we have a guide drill, which has a 3 and 4 millimeter. There's a spacer, a 1 millimeter spacer on here. But we're going to do everything through a punch hole. Okay? Does that all make sense?
All right.
So what we're going to do is take a look at this. This is kind of like our, this is way bigger than our device, okay? Because the device is this big, okay?
Okay.
So what we want to do is we want to just measure it. What we like is we like the tip of the pinna to be at the tip of where we think the device will be,
Okay.
so that it's aesthetically pleasing, but then it's also where the microphones sit at the ear level.
Okay.
So we would mark this with a pen, but we don't have a pen. So what we're going to do is we're going to use this is just a little bit of needle. You're going to punch that right through there all the way down to the bone. Then we're going to take this off and we're going to clamp it so that we have like a measuring tool. Yeah, just kind of twist it and get it all the way down to bone, and then leave it in there, and then we'll leave it in there, and then we'll take that that white piece off. Yeah, there we go. Okay. And so what we do is, while you have it down there, we're going to clamp that right at the skin level, and then we're going to measure this so that we know what our tissue depth is. Okay. So we're going to put the needle right on there.
About 5.
So it comes up to, this is our abutment sizes, so we know it's a 9.
Okay.
Okay, so that's good. So we have 6, 9, 12, and 14, just so you know. So now we know we're 9, we put this back, and now what we're going to do is, we can see where your punch hole was right here. So we're just going to biopsy punch that straight as you can, all the way down to bone, and just, usual biopsy twist and push pretty hard. And then we'll use the clamps. No, you're totally fine. Okay. Off is not off here. We can be off by a little bit. You're still going to get good bone conduction if you're a millimeter or two away. Okay. So you can see that it actually cut pretty good, but we do have this piece, which is it's called a bladed freer.
Okay.
And what we do is just kind of scrape the bone and make sure that periosteum's out of the way.
Okay.
To make sure that it's just, all you're seeing down there is bone, right? No more periosteum. Even if you just are scraping, you can even tuck it under, depending on what your feel is of it.
Okay.
Okay, good. And then this cannula, You're going to hold it like this while we're drilling, so it's kind of like a 90-degree scenario.
Okay.
But we're going to put that in, and then you're going to just kind of, it's fake skin, so you can kind of like move it around just to make sure that it goes all the way down to the bone. We get the skin out of the way.
I can feel it on the bone.
Perfect. Okay, so drill-wise, you can let that sit.
Okay.
That, whoop.
We can put it back in a second.
No, yeah.
Go ahead.
That cannula is going to stay in the entire surgery.
Oh, okay.
Okay, so there's going to be no.
So maybe it has to, I didn't get it under the skin enough.
Yeah, it's rubber. I mean,
Okay.
sticks is on the way down, so it's not like the your typical skin feel. And if it just stays in enough to be there, it's fine
Okay.
too. Perfect. Okay, so what we're going to do is we're going to add in. This is the guide drill.
Okay.
You can see it's a little smaller tip. We're going to widen it later. This is the spacer, so we're good to go. So you can
Okay.
hold this like this, that in there. Drills on 2,000, which is our speed. Big pedals big pedals the foot one. Yep, there you go. And I'm going to have you hold it,
Oh, the other way.
yeah, that way. There you go.
The opposite of what I think.
Yeah. And then we're going to go straight down. Once you get down, you can't go too far. Perfect. Okay.
And then it stops when it,
Yeah. And then what I'm going to do is fake irrigate.
okay. Blow a little bit.
Yeah, blow some dust everywhere. And then we have this piece. Oh, leave that on there.
Oh,
You're going to
okay.
leave that on there. You're going to just test with this opposite side of that dissector and just make sure that there's still bone down there. We haven't got to dura. We're still feel
Oh,
comfortable.
right.
Good.
Feels good, yeah.
Okay. So we'll leave that down. And then what I'm going to do is I'm going to remove this spacer. This is a 1 millimeter spacer.
Oh, I see, okay.
And then the hard part of this is the visual aspect. It's more of a feel thing.
Right.
So you want to put that, make sure that goes into the original hole that you had. You haven't moved it, so it's probably going to go right in there. But
There's a little countersink on it, right?
yep, and we're going to just, it's going to make it, oh yeah, don't hit the gas while you're putting it. Just let's
Okay.
get it in the hole and then
Okay.
get it set. There you go. Now you're good.
Okay.
Perfect. Okay. We're going to keep the cannula in still. I'm going to irrigate.
Okay.
And then we're going to check to make sure we still have bone, because this would be a deciding factor. If we have dura, we decide on 3 or 4.
Oh, you can feel it drop into the little thing.
The hole, right? Yep. Okay, so now we're good there. So that's this part. We're going to now put in your, and this is all it's going to do is use the same hole that you made, but make it wider.
Okay.
Make sure that's on there. So you want this to drop into the hole as well. Make sure that we're all the way in. And then just wiggle it around, make sure that you feel like you're in the hole. Looks like you're pretty good. Yep.
Okay.
Okay. Yeah, and it's a quick one. You're already done. Tap the gas block. I'm going to irrigate again. So what we're going to do now is switch this over to what is our abutment inserter. Wait, do we have, there it is.
Oh, take the plastic out? Okay.
Not yet. It's getting numb. Okay, so here's what we're going to do. I'm going to irrigate this, but what we're going to do is we're going to snap this. Is this the 9?
Yeah.
The
What
4-9?
do you call
Two
this
right
part?
there?
It's,
It's going to connect.
you call it
Yeah.
castle or something. What do you call it?
Oh yeah, we used to call it the castle. Yeah. And then what we're going to do is snap that right onto
Okay.
there. And if you want
right?
to, you can hit the gas while you're pushing it on and it'll click. You'll feel it click.
Okay, so you switched it to this little speed.
Yep.
How did you do that on?
On the
just
pedal, you can do it through the orange button,
okay.
but here I just did it through pushing the
Oh, okay.
screw button.
Okay.
There, you got it. Whoop. Push a little harder. There you go.
There we go.
Okay, so I cleaned this out. You're all good. So basically, we're just going to make sure that we're in the hole. We're going to count with that these
So you couldn't
wings.
do this it's in the way, right?
Correct, and it
So
doesn't fit through there.
comes
Yeah.
out. Okay, so then you just kind of, okay, I feel it at the edge there.
You feel like you didn't? Okay. So I'm going to line this piece up with the ear or something else
okay.
that's like on there, on the person, so that we can actually count. So we're going to count that. We want it to turn 4.5 times.
Yeah, how about irrigation? It doesn't really, but it doesn't matter, I guess.
You would have cleaned out the hole
Okay.
right before we started, and
Okay.
then you can irrigate after the first rotation because we really don't want wetness underneath
okay.
or any liquid underneath,
Well,
but
to lock it in, you want to keep
correct.
Okay.
keep it dry
You
and
want
then.
to engage okay, so stop at 1 revolution.
So no, we're going to go to
Keep
4.5.
Oh, okay.
But at 1, I would now start. If I was
okay.
irrigating, I'd start irrigating at
2.
1 rotation. 3, 4.
And
Okay.
then
So we now got 4, but we want really 4.5, although we feel like it's pretty stiff. So what we're going to do is we're going to wiggle that off.
Okay.
We know that it stopped right at this angle. So what I'm going to have you do is we're going to snap this on,
Okay.
and I'm just going to have you do a half turn.
And then.
Yep,
you
keep
don't-
going.
You want to over torque it though, do you?
You don't want to over torque it, but we know we still have a little bit left.
Okay, so that's a half there, I guess.
The
Or
little
almost
more.
a quarter.
Yep.
Okay. Okay. So that's a half.
Perfect.
Okay.
And now, if you wiggle that, you know that that's
It's
super
solid.
tight.
Okay.
And then we have these Alvin pads, but you
Okay.
can use Zeroform if you
Okay.
want to. But this will slide right over the top edge. And then we have this soft healing cap,
Oh, yeah.
which will then hold on the Alvin pad, and they're out of the OR.
Don't usually have to wrap the head or anything.
No wrapping, no nothing, just
Right.
kind of, unless you clean it off and you're good to go.
The
And they
other
can be
question
fit
is,
and
How high do you want it off the skin ideally? 3 millimeters or something like that?
this is about right. See, each of our abutments have a this little shoulder.
Oh, okay. So
You want this shoulder just to be above it, and the reason why is because when this top part gets very near the edge of the skin,
Oh, then it's a problem.
you start irritating the skin with the on-offs of the device, and then that becomes a problem. So a little bit, this is even maybe a smidge high, to be
Okay.
honest, but
Okay.
that's okay. This is
So
very, very good
If
because
anything, it's better be a touch higher. Okay.
you
Okay.
definitely want to be a touch higher than any lower.
Do you have that little measuring cheat
This
sheet?
little guy?
Yeah.
Yep.
So this is one way.
Okay.
When you measure, first thing we do with the needle, we put the needle down.
Right.
Yeah, we had it here.
You did it.
Yeah, we measured.
We came up with.
We came up with the 9.
Yeah.
So then you take this and you say, okay, if this is, let's say, 6 or 7 millimeters depth, and then it'll tell you here what is the equivalent abutment length that you want to
So
do.
it takes the guesswork out of it.
Takes the
Right.
guesswork out of it. Yeah.
Okay. That's very nice.
Yeah. And if it's like borderline, I go to the next one up.
The long one.
Okay.
Yep, that's perfect. So that's the MIPS, and then Amanda, maybe you want to jump in and do the mono one, or do we want to do the mono one video?
We could do next.
Let him do
All right.
something.
We'll do the mono one.
Yeah.
So this is going to be a little bit different. So that was MIPS, and that's 3 steps of drilling. Mono is when you know that you've either seen a CT scan or you know they have 4 millimeters of bone. There's nothing compromised on the patient. This is going to be a 1-step surgical technique, which truly takes about 3 minutes.
And what's the depth on that one? 3?
This is going to be 4.
4.
So they're just straight 4.
Most adults are going to be.
Yeah, this is adults
Correct.
only.
Yeah, this is we do promote adults only. That doesn't mean people don't use it for other things, but yeah. So I'm going to just remove this so it's out of our way, and then we'll do the mono together, doing the same thing. So we're going to do the same with the tissue measurement that we did before. We're going to just do a space just a little bit adjacent to this one. So let's just, up or down or anywhere around here is fine. And I'm going to give you the clamp. Here it is.
Where I'm at, Cochlear is kind of cornered the market with
Where are you at?
Redlands, California.
Okay.
But this is out there. But
Perfect.
If you were to, what's the advantage? I guess the minimally invasive approach. I guess.
And then our
Yep,
implant,
99,
our
yep.
abutment is also universal. So the audiologist, they could pick a Baja or a Ponto. It can hold both systems.
Yep, so punch right over there.
They'll put in only our implant, and then they can do whatever they want on the outside.
Yeah, this is a very nice.
Yeah, this also does not have hydroxyapatite
We have a number.
coating or anything like that on it. So the abutment also has a lot better outcomes and less complications than
Interesting.
Yeah, there you go.
that HA coating.
We've got a good amount of facilities that do only our implant, but let the patient choose the processor.
Oh, okay. And is this an example here? Can I see what the coating looks
Yep.
like? I'll put the
That's for you.
Um,
Oh, here, take this one. Yeah, kind of pull that aside. Looks good. So what we're going to do is add the cannula in. You're going to be like, well, this is too easy now.
Straight here, right?
Okay.
So the skin just stays up
Okay.
against that.
And then Sometimes, because it's just this rubber skin, if you kind of just pull the skin out, then it kind of holds it. Good. Okay, so what I'm going to do is add this piece in here. This is, and if you look at this drill, look at how thin it is. It cuts so much differently,
Okay.
and it actually cuts more efficiently. So when you do this, this is going to do everything.
And it's gonna stop like right there, right?
It'll stop where this will automatically stop it.
Right there, but in the
Yeah, in the
it's
in
gonna
bone, it's going to stop right there. Yep.
Yeah, when he's not, my phone isn't.
So you're on 2,000. You're good to go. I would be irrigating obviously throughout this when you're going. This is the crucial step, so we want to make sure. Yep, you look pretty good. And done. Okay, so as Jack said, you could take it out, but we like to keep it in because then otherwise the skin will collapse. Like sometimes it closes. It doesn't close that much, but I was just teasing him.
I guess because you're punching it out, it should maintain that.
For a little bit, yeah.
Okay.
Perfect. And then you can load that right on there. Kind of push and let it turn at the same time. Good. And then now you can remove the cannula. And let me do a little more irrigation in there. There we
So
go.
Dr. Watson uses these.
Yeah. And then you're going to kind of find the hole as you go in. Like you'll feel it kind of connect in there. There you go, and you can't move it. And then I'm going to move this around so that we count from the ear pinna. That's 2,
Yeah, probably, or email, doesn't matter, whichever you prefer.
3. Okay, so now we've only got to 3. What I'm going to do here is I'm going to turn this up.
Start calling my office to get.
So does this happen because of the orientation, or?
Sometimes the orientation, sometimes it's just different bone thickness. This is a little bit different as well. So yeah, so try and hit the gas there. That was 3. Okay, so that's, obviously it's a good bone. So we're just gonna, so I'm gonna put this exactly in the orientation it was before, and we're gonna wanna do like 1.5 rotations.
I'm pretty sure they have it there, but it'd be not, they've never used it.
Going in
So it'd be
easy.
nice
Okay.
to.
What hospital is it?
And I would
Just gonna make a
maybe
note.
put your thumb right on there so that keeps it on as you're turning it, you know what I mean?
Okay.
Private practice outside, but I do all my implants there.
Yeah, and then let's get all the way down
We
to
have issues with the cost of
there. Yeah, I
implants
love it.
and coverage, and my local community hospital won't let me do anything.
Great, all done.
And you said you want the shoulder a little bit above skin.
Yep.
Okay. So then we put this.
$6,000.
Yeah, pop that on, and then I'm going to show you what the device looks like on then after that. This. And then, so just so you can see,
What's wound care for them, and when do they come back to? The audiologist will give them that when
Yep.
everything is healed?
wound care is very simple, especially with this new technique. So basically, they can start showering and doing everything 24 hours to 48 hours after surgery. They can take this off, and then they'll come back to be fit about 4 to 6 weeks
4 to 6 weeks.
after
This implant.
whatever you're comfortable with. But truly, we say 3 months. That's what our FDA clearance is. But even their studies that have been done here at Silverstein, and a bunch of them around the country have been done, they're all pushed way up. Yeah, the new technology in the implant systems are fantastic. So
That's pretty cool.
yeah, quick and easy. Very good solutions. And the reason that they do a lot in West Virginia is because of the hearing aids aren't covered, but this is.
Yeah.
So they can get a very good reliability on this too. So
Cool. Yeah.
Good.
Well, feel free to reach out, okay?
we will definitely, yeah.
Since you're already in West Virginia.
Yeah.
So MIPS and the